back, everyone. Hope you got a chance to meet with some of the vendors. Don't worry, you've got plenty more time to meet and ask questions and collect information after this presentation. So I know we rushed you a little bit, but don't worry at all. You will have that opportunity in just a minute. It was also brought to my attention, is there a ramp to get to the vendors? Yes, there is a ramp. So instead of using the stairs, if you will pass all the vendors, you will see a sign that says restrooms, and that's where you'll see the ramp. So let us know if you need any assistance. All right, I want to introduce our next presenter. Stephanie Gill is the doctor of physical therapy at One Rehab. Dr. Gill attended the University of Florida in Gainesville, Florida, where she received her bachelor's in applied physiology and kinesiology. She's been a diehard Gator fan ever since and spends every Saturday in the fall cheering on her team. Dr. Gill then pursued her Doctor of Physical Therapy degree at Emory University in Atlanta, Georgia. While in PT school, she volunteered with the boxing program aimed specifically at working with individuals with Parkinson's. It was here that her passion for working with the Parkinson's community grew. And to this day, she is fascinated by the impact that exercise can have on the PD community. Dr. Gill has been a therapist at One Rehab for the last 2 years and has had the pleasure of working with patients with Parkinson's in all stages of the disease. Watching patients utilize movement and exercise to regain their independence is what drives her to work harder each and every day. Dr. Gill is also a certified LSVT BIG provider and enjoys utilizing and building upon these foundations throughout her experiences. As a physical therapist, she strives to create a treatment plan for patients that incorporates the physical, mental, and emotional aspects of the disease to provide holistic care for patients. So please help me welcome Dr. Gill.
Thank you. Good morning, everyone. I am so excited to be here with you guys. Again, my name is Stephanie Gill, and I am going to be presenting on the benefits of movement and exercise for fall prevention for Parkinson's. So she kind of already gave you a little brief rundown about me, but real quickly, I was born and raised in the beautiful Sunshine State of Florida, where I then went to undergraduate school at the University of Florida. I saw someone doing a Gator chomp over there. I don't really see a lot of Gator fans here in Texas, so that's really exciting. I then went and got my doctorate of physical therapy at Emory University in Atlanta, Georgia. And then while I was there, my fiance decided he was going to move to Dallas, Texas. And then I ended up following him, and I've been here for a little over 2 years and absolutely love it. I've been at One Rehab for 2 years at our Richardson location, where I function as the lead physical therapist there. Some of my interests are traveling. I just got back from a 10-day trip to Italy, which was absolutely amazing. Watching my Gators play football when they're doing well, and then my fluffy puppy Archie. I mean, look at this little cutie over here. All right, so let's get into our balance system, okay? So we have 3 different systems that work together to send information to our brain for our balance. So our first one is our visual system. This is going to paint a picture about our surroundings. Then we have our vestibular system. This is going to give information to the brain about our head's position in relation to gravity. And so if you've ever been on an elevator and you can kind of sense if you're moving up or if you're moving down, that is that vestibular system. Then we have our sensory system. So these are the receptors that are in our skin, muscles, and joints. And this is going to send information to the brain about, are we standing on something hardwood, something firm? Are we standing on something squishy? This is going to send information to the brain about that. So now that we know the 3 systems that comprise our balance, all those systems are going to send information to the brain, and then it is time for the brain to act. So we have 4 balance strategies that we use to help us maintain our balance. They work in a hierarchy. So our ankle strategy comes first, reaching strategy is last. So our ankle strategy is used when we are just standing quietly. So this is when, if you have just a small loss of balance or just standing here, you might feel like your ankles are moving a little bit. Maybe your toes are kind of gripping the surface. That's that ankle strategy. So let's picture that we are on the Skylink tram at DFW. Get onto the tram, you're standing there, waiting for the doors to close. Maybe you start to feel your ankles moving a little bit. That's that ankle strategy. Next, your hip strategy. So the train starts to move. It's picking up speed, and maybe you're noticing as it's changing directions, your hips start to move to kind of counteract that force. That's that hip strategy. So this comes into play when there is a smaller perturbation, so a small outside force that's kind of changing your balance there, a small loss of balance. Your hip is going to help you to counteract that force. Then you're on the tram and it starts to come to that stop. Maybe it stops a little bit quicker than you anticipated, and you take that step. That is that stepping strategy that we use. It is effective, but it's not necessarily efficient. And so this one is used for a large perturbation, a large loss of balance that you're not able to kind of control with your ankle or your hips, so you're gonna take that next step. Then we have our reaching strategy. So this is for my couch surfers out there, people who are using the walls for support, looking for the nearest piece of furniture for support. That's where this reaching strategy comes in. It is also very efficient, or very effective, but not necessarily efficient. So we want to use all of these 4 strategies in this order to be integral for fall prevention. But what happens is, as we age, we tend to not use that ankle strategy as much. We tend to use that hip stepping and reaching strategy more, which again, they're effective, but not necessarily efficient. And that's where we can start to have some of those issues with balance. Okay, so we talked about what comprises our balance systems, and then we talked about what we should be doing in order to keep ourselves upright and maintain our balance. So what exactly goes wrong in that equation? So some of the factors that are influencing our balance, these first 4 here are going to point to those systems that we talked about earlier. So visual changes, this can be like dryness of the eyes or double vision. That's going to affect the information that that visual system is sending to the brain, and that can influence your balance. Then we have sensory deficit. So if you've heard of peripheral neuropathy, that has been seen in a higher rate in people with Parkinson's. If you're not feeling everything in maybe your legs or your feet, that's going to impair the information that that sensory system is sending over to the brain. Then inner ear dysfunction and hearing loss. So that's that vestibular system. So if that's not working well, it's also going to impair the signals that are sent to the brain and how it's going to act. So these next ones here, leg weakness or tightness. We talked about that ankle, that hip strategy. If those muscles are weak or if those muscles are tight, we're not going to be able to utilize that ankle strategy well. We're not going to be able to utilize that hip strategy if we don't have that strength or if those muscles are too tight. Then we have core and back weakness as well as postural instability. So some of those common symptoms with Parkinson's, that forward flex posture, this is going to change our center of gravity. So our center of gravity is where our mass is kind of concentrated. And then our base of support is wherever our limbs are touching that surface. So like our legs, and then that area between your legs, that's our base of support. So when we have that forward flex posture, or maybe some of that trunk rigidity, that is going to affect where your center of gravity is, and then that's going to be outside of your base of support now, which is going to make it harder for you to maintain that balance. Then we have environmental hazards, and this I'll go into a little bit more towards the end, but essentially we talked about that visual system. We want to paint an image of our surroundings, and we want our surroundings to be nice and tidy. We don't want a bunch of clutter everywhere, cords everywhere. So we'll talk more about those environmental hazards in just a little bit. All right, so we talked about the balance systems. We talked about what goes into keeping our balance, and then also what might not be working out how we expected. So how can we help that? What can we do to improve our balance systems? And so this information comes from the neurology section of the American Physical Therapy Association. They essentially compiled a whole bunch of research on the benefits of physical therapy and exercise for Parkinson's disease, and then they came up with what is most beneficial. So what is the research showing that is actually going to provide the most benefits for this population? And so these 5 things is what they found has been most beneficial and really helps to improve those symptoms. And then also, as was mentioned at the last presentation, is that early exercise can actually help can help delay the start of those slowed movements, that posture, strength, and those motor symptoms that you see with Parkinson's. So to start off with aerobic exercise. So this is walking on a treadmill, using a stationary bike. This is going to help improve overall fitness, as well as can also help improve fatigue levels. Then we have resistance training. So maybe this is using some dumbbells at the gym or the machines. This is going to help improve strength and power. So this is really important with that bradykinesia, those slowed and smaller movements. We want that strength and power. So this is where resistance training can really help with that. Then we have balance training. So this is really, really important. This is where we're going to start working on those strategies that we talked about, that ankle, that hip strategy, helping to improve those that are very efficient for fall prevention. And then we have flexibility exercise, so relaxing tight muscles. This is going to help free your movements. And again, we talked about that ankle, that hip strategy. We need our muscles to not be super tight to be able to utilize those most efficiently. And then gait training. This is to help improve your speed of walking as well as those gait mechanics. If any of you guys have been in physical therapy, you maybe have your therapist's words ingrained in your head. Take big steps, hit with your heel first. So these are things that we really want to be working on all the time. So we talk a lot about the motor aspects of Parkinson's, but a lot of the times, because it's a movement disorder, we tend to forget about some of those non-motor components of Parkinson's as well. And so not only can exercise be important for those motor symptoms and helping to improve overall posture, balance, and strength, but exercise has been shown to help with the non-motor components too. And so Parkinson's can affect mood, it can affect sleep, it can affect cognition, and that can affect your overall emotional health. But exercise has been shown to impact many areas, even more than what's listed here, but things such as depression, anxiety, memory, and fatigue. And it's actually been shown that aerobic fitness can help memory the most, but that all of these modes of exercise that I mentioned on the last slide can help with all of these cognitive functions in people with Parkinson's. So there's a lot on this slide. I just want to briefly go over what that practice guideline that the neurology section put out, what they recommend in terms of how you should be getting that exercise. As our last presenter said, there's physical therapy, and that's different from exercise. We want you to be doing some sort of exercise every single day. And so here's kind of a little bit of a rough guideline on how to get about doing those exercises. So we talked about that aerobic conditioning and how important it is for memory, for all of those motor symptoms as well. So this is something that you should be doing 3 times a week at a moderate to high intensity. So not so much just casually sitting on the bike, reading a book. This is something you really want to get your heart pumping with. Then we have resistance training. This is something that you want to try to do 2 times a week, but just not back to back. You want to make sure that you let those muscles have a little bit of time to recover in between. And then gait training. Okay, so this isn't just, well, I walked to the bathroom, and then I went to the kitchen, and then I walked into this room. I got my walking in today. This is time that you set aside to really intentionally focus on that gait training. And so this is something that should be done 3 to 5 times a week. And this is working on those mechanics, taking those big steps, making sure you're lifting your feet, hitting with that heel first. And then flexibility training is something that you're going to be doing incorporating into those other exercises. So this is something that you can do at the beginning of exercise. And so if you're gonna do it at the beginning, rule of thumb is you're gonna try to do this as more of a dynamic warm-up. So maybe you go for a little bit of a walk before you do some resistance training. Or maybe you do some arm circles before you work out your arms. Maybe you do a little bit of like a knee to chest as you're moving and walking, that kind of dynamic stretching. And then at the end of an exercise, that's where you're gonna do more of that traditional stretching. So maybe you're gonna hold that hamstring stretch for 20 to 30 seconds. That's when you would wanna do those. You wanna make sure your muscles are warmed up before you go into those static stretches. All right, so the fun part. So what I'm gonna be showing you are a few exercises that I really, really enjoy doing with my patients. I feel that they help with your overall functional mobility and just things that you might be doing in your day-to-day and helping you to be more efficient with those movements so that you can make sure you're doing these safely and not having any falls, okay? So for these exercises, I have demonstrations both in a standing and a seated position. Please feel free to join in with these exercises, but however you feel comfortable. If you want to stay in your chair, if you want to stretch a little bit and stand up, also feel free, if the person in front of you doesn't mind, if you use their chair for a little bit of support if you need it, okay? And I also have some really, really awesome videos of patients doing these exercises, just showing off how well they're doing. All right, so, okay. So, I'm gonna get a chair out here so I can kind of show you guys. All right, I don't wanna be too far in front of the screen. Okay, so the sit to stand. This is one of those exercises that is really important to make sure we're doing it efficiently and safely. So one, you're not having to use a whole bunch of energy to do your standing up and sitting down wherever you might be, but also making sure that you're doing it safely, okay? So the first thing you wanna do is, at whatever surface you're at, whether it's a really squishy couch or it's a firm chair like this one, you always wanna sit at the edge of that chair, okay? And then next, yep, I see everyone adjusting, good job. All right, so next what you wanna do is you want to lean your trunk forwards. So this is that nose over toes, okay? You wanna shift your weight forwards so that when you go to stand up, your weight is in your legs. Those are those strong, powerful muscles, so you wanna make sure that you're using those, okay? So you're gonna be at your edge of your seat. You're going to lean your weight forward so that your weight is onto your legs and stand up nice and big. Awesome. And then to sit down, you can either make sure that you feel your chair behind your legs so that you know something's there behind you, or if the chair has arms, you can always feel for those armrests if you're just worried about if that chair is right behind you. And then what you wanna do is you want to make sure that you bend your hips backwards, okay? We don't wanna be putting excessive stress on our knees, so you wanna bend your hips and your knees backwards, shifting that weight back to gradually sit down. Awesome. Nice job. Let's go ahead and try that one more time, okay? So we're gonna sit at the edge of that chair. Good. Oh, I got some eager people here. They're already up. Good. And lean forwards and stand up nice and tall. Very good. And then if you need to, feel for that chair behind your legs, reach your hips backwards, and slowly sit down. Awesome. And also don't feel like you have to remember all these steps. I have handouts with all of the exercises that we're gonna do today with instructions and how often you should be doing them that you guys can pick up afterwards. All right, now we have a squat to press. This is a really great one to help improve your standing up and sitting down. It's also a really good one if you found that you're having some difficulty with reaching forwards and bending forwards to grab something off the ground, or maybe you're having some difficulty with reaching up and grabbing something above your head. This is a great exercise. So with your arms by your side, and I'm gonna show you also how to do this one seated or standing, so feel free to do either one, but with your arms by your side, same thing as when you're sitting down, you wanna make sure that you're shifting your hips backwards, okay? Having more of that weight in your heels versus in your toes. So you're gonna have your arms by your side, shift your weight back as far as you can go, and then you're gonna explode up to the top, reaching as high as you can, and then back down to your side. Awesome. And I wanna show you guys really quickly that seated version as well. If you wanna do this in a seated position, I just recommend that for all of the seated exercises that you do, you are not putting your back up against this backrest, okay? That's gonna allow you to engage your core more and not be relying on this instead. So for this one, same thing, you're just gonna lean forwards as much as you can, and then exploding up to the top, reaching as high as you can. Awesome job. And I've got a great video here of one of my patients doing the exercise. So we added some weights to this one to make it a little bit harder. Notice how these movements are slow and controlled, okay? We don't need to do these quickly. It's not a sprint, it's a marathon, okay? Nice and easy. We want to have more control than anything with these exercises than necessarily just trying to run through them. So I will go back to this first slide real quick, and we'll just go through this one more time. If you want to do it seated, if you want to do it standing, completely up to you, okay? So hands by your side. Good. Shift that weight backwards as you come down, weight in your heels, and then exploding up to the top as high as you can. Awesome. Good job, everyone. Getting a good stretch this morning, huh? All right. Okay, this next one is marching. This is a really good exercise to work on standing on one leg. It's really good for your gait mechanics too, because as you're walking, there's actually a period that you are just standing on one leg. And what can happen is with those shuffled gaits, it's kind of your body's way of being really efficient too, saying, well, if I don't pick my feet up off the ground, I don't have to stand on one leg, which can be a little scary. And so we want to learn how to improve that single limb stance so that we can improve that gait cycle and taking those nice big steps. So for this exercise, you can do it seated or standing. I'll show you guys both. So if you're going to be standing, both of them, I want you sitting up or standing up nice and tall. You are going to shift your weight over to that stance leg so that you can lift the other one. If you don't shift your weight, it's really hard to pick up that leg. So make sure you shift your weight over, lift that leg up, and then down. And then shift your weight to the other side, lift up, and then down. Perfect. Then we have the seated version of this exercise. So again, make sure you're not resting up against that backrest. Really engage your core with this one. This is a great one to engage your core, which is super, super important for your posture. So what you want to do is same thing. You're just going to sit up nice and tall, lift that leg up, and then back down, up, and back down. Awesome. So I have a video as well. And this is one of my awesome patients. Notice how he's taking his time with these marches. All right, so let's go through that one more time, if you want to stand or if you want to stay seated. Okay, so shift your weight over to that stance leg. Lift up and down, shift, up and down. Awesome job. All right. Okay, so side steps. This is where we start to get outside of your base of support. So we talked about that base of support is whatever is touching that surface that you're standing on, so your legs, or if you have a cane or a walker, that is included in your base of support. So this side step is when we start to step outside of that base of support. And so this is really good for transitional movement. So when you stand up and then you have to take a step, this is a good one to practice that. And then it's also just really good for kind of just taking those big steps that you guys have probably heard over and over again, taking those larger amplitude movements. So for this exercise, you can have your hands by your side. That would make it a little bit easier. If you want an added challenge, you can reach outside of that base of support as well while you step, okay? Take as comfortable of a step as you feel taking here today, okay? I'll also go over this seated one first here so that you can see how to do this one too if you feel more comfortable. So making sure that you're at the edge of that chair, you want to go ahead and reach that leg out and back. And then, yeah, if you want to go ahead and reach your arm out, really try to reach outside of that base of support and then back. Good. And reach outside of that base of support and back. Awesome. So let me show you a video for this one as well, and then we'll do it all together. So notice here, when he's taking that step, he's making that really good effort to, when he takes that step back, he's picking up that leg, taking a really big step to come back together and not letting that foot drag as he comes back, okay? So really important to pick your foot up. So maybe just start with a little bit of a smaller step at first so that you can get comfortable with picking that leg up and not letting it drag when you do this movement. All right, are you ready? Okay. So if you want to add that arm reach in there, just make sure you don't hit your neighbor, okay? So let's go. Exactly. All right, so we're going to take that big step out and lift that leg to come back. Good. Big step out. Lift that leg to come back. Good. Let's go ahead and do the other side now. So big step out. Back together. Big step out and back together. Nice job. Everyone looks great out there. Okay, I love this exercise. So this is where we start to get a little bit of that trunk rotation. Okay, so I talked about earlier that trunk rigidity that can also cause that forward flex posture. This is a really, really great exercise to get that trunk rotation. It actually helps with that vestibular system as well, because we're gonna be following our head movements with our hand. And it's also just a great one for overall just functional mobility as you're having to bend and reach, okay? Some things that you're probably doing throughout the day, every single day. So to start off with this one, you can have how I have pictured here, and I'll show you a way to kind of make it a little harder in just a second. But your feet are just gonna be about shoulder width apart, okay? And then you are going to reach over your head to one side. This shirt is not conducive for this exercise. Okay, so reaching up above your head, and you're going to follow your hand with your eyes in your head as you do this movement, as you reach from up here all the way across to your pocket. And if you want to make it a little harder, you can reach all the way from up here, all the way down to your knee. So you can see where we're getting that really good trunk rotation here, making sure you're following your hand movement with your eyes in your head the whole time. And I'll go ahead and show you guys how to do this one seated. So same thing, you wanna be at the edge of your chair, you're gonna reach up as high as you can, and you can either go down to your opposite pocket, or you can reach up and go all the way down to that knee, okay? So I'll show you a quick video. So I have him actually challenged him a little bit on this one, where he's actually standing with 1 foot forwards and 1 foot back to kind of narrow that base of support and make it a little bit more challenging. And in this one, he's just holding a ball. You can hold on to just clasping your hands or hold on to an object, completely up to you. Notice how he's following the movement of that ball as he goes into the motion. All right. Ready? Okay. So let's go ahead and reach up to our left side, okay? So we're going to reach up and reach all the way across to our right pocket. Good. Reach up and all the way across. If you want to on this next one, you can try to reach for your knee. So reach up and all the way across to that opposite knee. Awesome. Let's go ahead and switch sides now. Let's try that right side first. Reach up and all the way across to your pocket. Good. Up, all the way across. If you want to try and reach for that knee, all the way across to that knee. Awesome. Everyone feeling a little looser? All right. Get a sip of water. Okay, so next we have some warrior twists. This is another great one to work on that trunk rotation. Yes? Oh, awesome. Okay, so what we're going to be doing is you are going to step into that lunge. So we're kind of incorporating some of those exercises we did a little bit ago. So you are going to step, but this time you want to point your foot towards the direction that we're going to be twisting in. So we're going to twist to the front, back, and together. Okay, so you'll take a big step, reaching your arms, turning, back, together. And then I'll show you guys how we'll do that one seated. So same thing, you want to point your foot in that direction, turn as best as you can, forwards, together. Reach, being careful for who's around you, and back forwards and together. I also have another video where we made this a little harder. I just had to show off my patience here. So he's stepping onto a squishy surface while doing this exercise. All right, so let's go ahead and try this one real quick. Okay, you seated or standing, completely up to you. So we're going to take that big step, reaching out with our hands, turning to the side, back forwards, and together. Let's go ahead and try that other side now. Step out to the side, turn, back forwards, and together. Awesome job. All right, so real quickly, I just want to go over some stretches. So I talked about how these are really important to make sure we can utilize those balance strategies that we mentioned earlier. So these are all in that packet, that handout that I have for you guys. So I won't go too much in depth, but again, these are those static stretches that you would probably be doing at the end of an exercise, holding for about 20 to 30 seconds at a time. That pec stretch there at the bottom, and on the bottom picture there to my right is what you would be doing as that pec stretch to really open up your chest and help improve that posture. So you would be doing this in a doorway, stepping forwards just a little bit and stretching this area here to help with that forward flex posture. All right, so a couple other things that can go into your balance that you can kind of do pretty immediately to help improve your risk for falls and just your overall stability. So shoes, this is a really big one. I have so many patients that love their house slippers, love their flip-flops, or just walking around in socks, but this is not really the safest. So with that shuffling gait, if you're not picking that foot up and you're wearing a slipper, your chances of tripping over that shoe are a lot higher. So wearing a shoe that is supportive and also provides good ankle stability is very, very important. Then, keeping your house well lit. We talked about that visual system. As we age, we tend to rely on our visual system over the vestibular and sensory systems. So, when it's dark, we're really challenging that visual system, and so we want to make sure that keeping areas in your house that you're going to frequent at night, keeping those well lit. So maybe putting a night light in your room and in your bathroom so that you can go to those areas pretty easily and not have so many balance challenges. Then your environmental setup. Make sure that your house is free of rugs. It's free of electrical cords and things that you might trip on or create obstacles. Why create extra obstacles? Let's just keep a nice, clear path for you in your house and in your environment so that you can prevent anything that could cause a fall. And then also using things like grab bars in the shower or mats to make sure that you're not slipping in the tub or as you step out of the shower as well. And then multitasking. So there's actually been research to show that multitasking can have an impact on your cognition and your walking, such as your speed and your step length. So if you're trying to walk and you're holding a bunch of things in your hands, this can actually affect your walking speed and your walking mobility and your cognition as well, and put you at a higher risk for those falls. And then assistive devices. If you're one of those couch surfers, I heard a lot of people kind of snickering when I said that. If you're noticing you're using the couch a lot or furniture a lot, it might be time to look into getting an assistive device. And with that, you want to make sure that you talk to a professional about it who can recommend something that's going to be most beneficial for you, whether that's a cane or a walker or a rollator. They can help you with finding the proper assisted device and also making sure that it fits you properly and how to use it safely, like if you're going up the steps or going up a curb. All right, are there any questions out there? Everyone's all tuckered out after those exercises. So, yes. So how often, like how many times during the day would I recommend doing these exercises? So really, it just depends on kind of what program you're doing. So maybe you're going to be working on like that exercise prescription that I mentioned earlier. You're going to do some gait training. That just needs to be done once a day. But maybe you want to do some gait training and at the same time you're going to do those stretches. Ideally, just once a day. Sometimes I recommend for stretches doing it in the morning and at night. But aside from that, most of these you're just doing them once a day. And unless you're kind of adding like some walking and you're going to do strength training that day kind of thing.
You mentioned 20 to 30 seconds for a stretch. Is that kind of best practice for almost any stretch that you might engage in?
Pretty much. I like to say 20 to 30 seconds because I really like to emphasize a gradual stretch where you kind of start off going easy into that stretch, and maybe as you kind of get into that stretch, you can go a little bit deeper. But what you want to avoid is kind of going back and forth into that stretch. And by doing it for about 20 to 30 seconds, you're ensuring that that muscle is nice and relaxed in that time period. Yes. We got. Hearing aids. So that's a tough one. I'm not sure I can completely answer that one. I think it's more that vestibular system. Hearing loss can definitely impact your balance because that's part of that inner ear. I can't tell you the specifics on like if having a hearing aid or not would improve that balance. I'm not exactly sure on the answer to that one. Yes.
I've had Parkinson's for 8 years on construction, and I carry lumber and plywood and things like that. And recently, I've had trouble where I take Ritari as my med, and a lot of times you can't tell I have Parkinson's at all. It's very well managed. But I've developed over the last 3 months, from 9 to 1, my legs from my knee to my hip get really hard, and I'm literally down, I can't walk.
Okay.
For about 3 hours, and then it goes away, and I'm good.
Okay,
Would exercise, lack of exercise cause that?
I wouldn't say that necessarily lack of exercise would cause that. I think that exercise could potentially help improve that. But kind of what our last presenter talked about with some of those fluctuations in where those medications are working, I think that would definitely be something to talk to your neurologist about and figure out, why is it that every day around this same time I'm really having difficulty moving? But I would also maybe recommend trying some of those stretches and some of those mobility exercises in those periods to see if that doesn't help a little bit.
I notice I have trouble sometimes when I've been sitting for a while and I try to get up and go to my walker or reach for my walker. My leg collapses. Do you need to exercise or stretch before you get up?
Yeah, I would definitely recommend like maybe doing, so I like to say that movement is like the WD-40 for our body. Sometimes we just get a little stiff, and so maybe it's just a little bit of doing some stretches before you stand up, maybe just doing some of those seated marches to kind of prep your body for that movement, and then also using some of those mechanics that we talked about, making sure you're sitting at the edge of the chair, really leaning forwards onto your legs to stand up, and then having that walker there in front of you once you get into standing. All right, if there's any other questions, I'll be over here to answer them, and then please make sure to pick up one of those handouts so that you can have all of those exercises available to you.
Thank you so much, Stephanie. Wasn't she wonderful? We just met over the summer, and I was so excited when she was eager to get involved with DAP. So we're so excited to have you join us and all of your great information. Thank you. So we are now going to break for lunch, and so in order to do that, we have some wonderful volunteer magical elves that are going to transform this room into tables and chairs. So while we're doing that for the next 15 minutes, please take advantage of going to visit any of the vendors or the sponsors that you didn't have a chance to visit with. Make sure you use the restroom if you need to, and then in 15 minutes, we will open it back up, so we'll have lunch, and then you can enjoy the second half of the day. And remember to get your passport signed so that you have a chance to win the prize.